Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
I get asked the question often, what is the difference between osteoarthritis and rheumatoid arthritis? So today I thought I would break that down for you so you have a better understanding. At the end of the day, we know that inflammation is associated with both of those. So I want to really kind of differentiate between what is OA and what is RA. So I am Amanda Williams, MD, MPH, and when it comes to osteoarthritis, we know that this is the most common form of arthritis when we think about degenerative joint disease. And this is generally affecting your more weight-bearing joints, as well as it can affect the hands. And this is where that confusion oftentimes comes in, and that overlapping between osteoarthritis and rheumatoid arthritis. Now, the common thought for many years was that rheumatoid arthritis was 100% just an autoimmune condition. And we know this to be the case. We know that this is our immune system attacking the joint spaces. But we now recognize that osteoarthritis as well has this autoimmune component to it, where it used to always just be considered kind of a wear and tear of the joints. You know, you have injured knee, eventually you could end up having osteoarthritis. So that was always the common way to think about this, but we have to think about inflammation in general, and that is our immune system driving that. So in a sense, osteoarthritis has that autoimmune component as well. But when we're looking at actual serum blood markers and the severity, then rheumatoid arthritis is your clear autoimmune driven arthritis. And we know that for most people who end up getting osteoarthritis, which is very, very common, by the way, and many people don't even have doctor-diagnosed arthritis because maybe you have a sore knee all the time, but you don't happen to mention that to your doctor. So it's not a diagnosed OA, but we definitely know that the millions and millions of Americans who have osteoarthritis is very, very high. Thinking about the joints themselves and, what can exacerbate this? Well, clearly we know that, different activities throughout our lives can create more wear and tear. So this can impact both RA as well as OA. We have to look at diet and how much of our diet, if we're eating a pro-inflammatory diet, well, then that's not going to be helping our joints in any way. So that can actually exacerbate the whole inflammatory process just by having a pro-inflammatory diet with the degenerative joint disease that's actually occurring. So we know that diet plays a role. We know that certainly wear and tear from, physical activity. We also can look at other health conditions that maybe can be contributing to the degeneration of the joints or creating additional inflammation within the joints. So clearly the first one that jumps out is usually diabetes, because we know that with diabetes, we usually have higher levels of oxidative stress and glycation, and these can certainly have a significant impact on the joint structure and function. And there's a lot of moving parts when we think about our joints, and you have the cartilage, that's the tissue that's actually covering the bones at the joint, and you have your synovial fluid, and that helps with that lubrication of the joints. That's the sticky-like, gel-like substance. We have our ligaments, we have our tendons, and we can see how if we start to have a breakdown in any of these, then we can experience these symptoms that go along with arthritis. And this is why I always explain this to folks is when you have knee pain, is it because you don't have enough synovial fluid? Is it because the hyaluronic acid has started to diminish? Or is it a cartilage issue? Or is it a tendon issue? Sometimes it's a combination of all of them. But this is why sometimes people grow frustrated when they're taking formulations to target joints, because maybe you're using one thing, but that's not necessarily why your joints are bothering you. So a multimodal approach is always advantageous, because when we think about the main symptoms that go along with osteoarthritis, the pain and the tenderness is usually the most common complaint that people have. Now, you can also have the swelling within the joint. This is obviously going to drive up that discomfort as well, because when you think about the nerve interventions that occur around those joints, this is part of that reason that drives a lot of this. But we also know that there are many other problems that go along with arthritis, including an increased risk of falling, because if you have, pain or stiffness within your knee, for example, and you go to get up and you think you're going to just take your first step and your knee kind of gives way, then we're at this greater risk of falling and potentially a fracture. So there's a lot of different moving parts, we will say, when it comes to arthritis. We know that age plays a factor. We know that our weight plays a factor. Obesity, there is definitely an increased association with osteoarthritis, especially within the knee. We certainly can look at hormonal implications and seeing that certain hormones may play this association with the degeneration of the joint itself. So there's a lot of different things that we have to consider. But we know that when we're looking at RA and we're looking at OA, so back to this comparison between rheumatoid arthritis and osteoarthritis, we know that the main focus needs to come down to targeting inflammation and creating a stability within the immune system to help to down-regulate this. So this is why different nutrients that help to target the inflammation, such as your omega-3 fatty acids, for example. We know that if we have that imbalance, we have too many omega-6s and not enough omega-3s, this will help to drive up the inflammatory process. We can also look at how different nutrients such as vitamin D can play a role. We know that vitamin D has been linked to having worsening of pain symptoms in so many different conditions, and including arthritis. So if someone is insufficient or deficient in vitamin D, then this is certainly going to be a problem. But we also know that vitamin D plays a really big role in that regulation of our immune system. So for anyone who has RA in particular, having those serum blood levels tested to see what your vitamin D level is incredibly essential. But we want to be able to target all of those different pro-inflammatory cytokines and looking at how we can help to downregulate this. So we're looking at things that are going to target NF-kappa beta, COX-1, COX-2. So certainly we can look at things such as curcumin extract, those curcuminoids, looking at boswellia extract. We certainly can see the benefit of that. Even nutrients such as green tea extract has been shown to be, in clinical research trials, to be highly effective when targeting both osteoarthritis as well as rheumatoid arthritis. So there are many different commonalities between the two, because at the end of the day, we're having inflammation within the joint. But with rheumatoid arthritis, we know that this is solely driven because of the offsetting of our immune system itself. So then we need to start looking at the gut and the role of the, microbiome, how this can be kind of fast tracking someone who has RA. So if you have an unhealthy gut, this is certainly not going to be of a benefit to you in terms of trying to control or regulate your joint discomfort. Now, most people who have RA are put on, different powerful non-steroidal anti-inflammatory drugs. Most people have heard of, things like Celebrex, for example. And this is kind of a common thing, but they are also many times given very powerful immunosuppressants. And this, for many people who have been diagnosed with rheumatoid arthritis, which is done not only through just, diagnostic history and physical, but this is done through confirmation of the different markers to show, rheumatoid factor is the main one that they would be looking at. So you can see the immune system itself via looking at the blood testing. But we have to also be able to recognize how there's so many other factors that are playing a role when it comes to RA. So for those who are not interested in taking a powerful immunosuppressant, which maybe leaves the door open for other immune system complications, then they often are looking for, what else can I do? And this is where your type 2 undenatured collagen would come into play. And we can see how using type 1 is your most common type of collagen. And this is beneficial across the board because as we get older, we know that we're losing our type 1. So whether we're looking at RA or OA, having regular hydrolyzed type 1 collagen is a must-have. But then when we think about the loss of the collagen and the exposed collagen fibers, this is where the immune system can really go into this heightened attack mode, especially when we're thinking about RA, rheumatoid arthritis, because the immune system's already ticked off. So in this setting, utilizing type 2 undenatured collagen helps to kind of desensitize the immune system's attack. So it can recognize that exposed collagen and say, okay, well, this is supposed to be here. We don't have to attack this. And this is really very important. So this is why when people have rheumatoid arthritis as well as even osteoarthritis and they start to use the type 2 undenatured collagen, that they can really start to see those true profound benefits. So you can find that in our cartilage HX formulation, and that's just strictly the type 2 undenatured collagen. So understanding that rheumatoid arthritis, we're looking at this systemic inflammatory disease that's driving up a lot of pain along with disfigurement, especially when we think about the peripheral joints. When we look at the hands, for example, this is usually the most common place to which that systemic inflammation really does a lot of that damage and dysfunction. So we can see that there are different components to both. We know that inflammation is a driving force to both osteoarthritis as well as rheumatoid arthritis. But to target the inflammation is essential for both. Now, the reestablishment of different key components, I don't want to say is only for osteoarthritis because that doesn't make sense. So when we look at things like glucosamine, chondroitin, MSM, for example, this is going to be beneficial whether you have osteoarthritis or if you have rheumatoid arthritis. So there's a lot of that confusion when it comes to, well, what nutrients should I use based off of what type of arthritis I have? At the end of the day, it kind of overlaps because we're trying to have as much of a comprehensive approach to maintaining the stability of the joint, the functionality of the joint, and at the same time, we really want to help to reestablish balance within the immune system. And this is where your omega-3 fatty acids, that vitamin D comes into play, and all of those different nutrients that can help to ease inflammation and better regulate that cytokine and interleukin release. So that's where you're looking at your curcumins and your boswellia extract. So our biocurcumin 5-loxin formulation is that combination of those two. It has the curcuminoids along with that boswellia extract. So like I said, a lot of overlaps between the two. Clearly, rheumatoid arthritis is the more severe because that is, directly linked to a lot of other problems within the body besides that of just the joint, because whenever the immune system is flared up, we know that that's going to affect every single system. And when we think about osteoarthritis, we definitely understand that inflammation as well is a driving force to that. So we don't want to say, oh yeah, osteoarthritis is solely wear and tear. Well, yes, it's wear and tear, but now the immune system is revving itself up and creating an excessive amount of inflammatory cytokines, which is what drives so much of the pain in both conditions. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.